Hi, this is Dr. Paul with carinjurycare.tv/Citrus Park, where we answer the most common car injury questions, medical and legal. So we're talking with Dr. Wallace Wade here of Citrus Park Chiropractic, and the question today is, after you're in an accident, your body goes through 3 phases of healing, and the second phase is called the repair phase. So let's talk about that a little bit. What does that mean when somebody's in an auto accident and they go through 3 phases of healing? And the second phase is the repair phase. What does that mean? What happens to the body?
Well, the body starts to repair the damage caused by the inflamed tissue, and it produces a protein called collagen. You might know it as scar tissue, and that collagen is very important that it heal properly, or it becomes damaged and you have problems in the future.
Now, in this repair phase, what are some of the aspects that happen with the collagen? So the collagen's laid down, what happens?
Well, there's 4 negative characteristics to collagen formation. First of all, it's only 80% as strong as the original tissue. So it's very important that you get proper physical medicine care to make sure that it doesn't heal with decreased strength. The second negative characteristic of collagen is that it's only 70% as elastic. What that means is it's not as flexible. So if you don't get the proper care of getting that tissue treated, then you're going to have less mobility in that part. Maybe your neck, or maybe your lower back, or if you have a shoulder injury or a knee injury, it's not going to work. It's not going to be as flexible as it should. In the same way with the decreased strength, it's not going to be as strong. You're more susceptible to re-injury in the future.
So you're saying if you don't get physical medicine and you only take medication and your body heals wrong like that, you're going to have decreased strength and mobility permanently to some degree the rest of your life in that area.
Absolutely.
That's what will happen. Now, what happens, a lot of times patients are more painful after an injury for years and years. What happens in the repair phase relative to pain and the nerves?
Well, what happens is that in that collagen tissue, more nerves are laid down. And what will happen in the future, you'll be more susceptible to pain because there's going to be more nerves there, and that's what nerves do. They're painful. They cause pain.
And what about the sensitivity of those nerves?
Well, also what happens, and that's the 4th negative characteristic, is there's an increase in the sensitivity of those nerves. So the patient will feel more pain, be more sensitive to pain in the future. So they're going to have problems in there for the rest of their life, and they're going to have problems of re-injury, more pain, more sensitivity to that pain.
So I imagine in several years you've been practicing, you've dealt with patients who've been in automobile accidents, and that's exactly how they healed.
Yeah.
They healed wrong, and so years later they come in here with problems. How much of that do you see?
Oh, I see it quite often. The patient will come in and they say, well, I don't know what happened. I woke up this morning and I didn't do anything, but I'm extremely painful and I can't move in my lower back or even my neck. And what happened is they healed wrong. The collagen healed wrong. It's less decreased strength, decreased there's an increase in sensitivity, increase in the pain in there, and it's a lack of flexibility. They'll say, well, I don't know why I'm having headaches now, or I don't know why I have this neck pain. And after I consult with them, I find out, oh yeah, I had an accident about a year ago, but I wasn't injured. Well, they were injured, and now they're seeing the complications of it.
Well, let's say they knew they were injured, but they were treated with medicine. They took medicine through the whole course of their treatment. What's the difference between that, getting treated, versus chiropractic care after an accident?
They heal wrong. The collagen formation doesn't lay down the proper strength to it, the proper flexibility to it.
So you're saying medicine doesn't help that?
No, medicine doesn't help that.
Okay. So to change that, you're saying a chiropractor and what chiropractic does can change that?
Absolutely.
How can a chiropractor change those negative 4 characteristics of healing?
Well, they do it through motion, active motion, passive motion, and also with the chiropractic adjustment, they go into joint motion. And that's characteristic of a chiropractic adjustment where we actually move the bones a little bit farther than you could. It's like my elbow. I could compare the elbow joint to, let's say, your neck. You were injured in your neck, to the joints of your neck. I can move my elbow so far, and that's called active motion. That's like exercise. Now, someone can come along and move my elbow a little bit farther. That's called passive motion. And typically, physical therapists work with active and passive motions. But when you get a chiropractic adjustment, it can be moved a little bit farther, and that goes into what we call joint motion. And that joint motion actually helps the collagen or scar tissue heal with increased strength and increased flexibility, therefore decreasing the patient's chance of re-injury and pain in the future.
So what I'm hearing you say is the physical component of chiropractic, the physical medicine of chiropractic, can impact the repair tissue and help it to increase strength and mobility. Is that what I'm hearing?
That's what you're hearing is characteristic to a chiropractor.
Okay. And so that's really the big difference between chiropractic and medicine after an injury.
Right.
That makes sense. Okay. So you can essentially, is what I'm hearing, you're telling me that if you treat somebody pretty quickly after an accident, you can actually help them to not have a permanent injury the rest of their life?
Yes.
I see. Okay, that makes sense. How long, in that repair phase, how long does that last?
Well, the repair phase will last anywhere from the fourth day up to about 12 weeks.
12 months. And you talk about collagen. Is there anything nutritionally that can help or hinder me with collagen? Is there anything that I can do to help that process better?
Yeah, I mean, taking vitamin C, that vitamin C has been shown to help healing tissue. Also taking copper, that helps in healing of that tissue. There are two proteins called lysine and proline, and they're very important that you take these forms of supplement, because many times in your diet you're not going to get the dosages that are needed to help with your body repairing that tissue properly.
And you're saying that those help collagen help collagen better?
Yes.
I see. What would you say the one or two negative aspects after an injury that inhibit healing?
Well, smoking.
Why is that? If somebody smokes, why does that hurt them from healing?
It decreases the vitamin C. When you're a smoker, you have less vitamin C. You're not oxygenating the tissue that needs oxygen in it, and you're creating a problem. You're also taking in nicotine and other forms of drugs. Nicotine is a drug, and it helps inhibit the healing process.
So if you're smoking after an injury and your body's trying to heal, you can actually be setting yourself up for a permanent injury?
Yes.
I see. Well, that's interesting. All right, well, very good. Well, this is, again, Dr. Paul with carinjurycare.tv/Citrus Park, and I'm talking with Dr. Wallace Wade. We have over 50 other videos of the most common car injury accident questions and answers, medical and legal. Head on over there now, pick them up. It's an abundance of information that will help you out if you've been in a car accident. It's carinjurycare.tv/Citrus Park. We'll see you over there. Take care. Bye.